Welcome back. You are still watching Good Morning Namibia. Now, the Ministry of Health and Social Services will commemorate Tuberculosis Awareness Week this October, a time dedicated to reflecting on the progress made, the challenges that remain, and the new developments in TB prevention and control in the country. Despite the strides achieved over the year, TB continues to be one of the country's major public health concerns, demanding sustained commitment, innovation, and collaboration to eliminate it. Joining us this morning in studio with more on this is Evangeline Paulus, the community-based TB care coordinator in the Ministry of Health and Social Services, as well as Karen Husselman, the founder of TB Free Namibia. Good morning and welcome to the show.
Yes, good morning and thank you very much.
Good morning. Nice to be here.
Thank you for being here. Now, to start us off, let's start with you, Ms. Paulus. Yes. What is the main theme of this year's TB Awareness Week? And how does that reflect Namibia's current TB control priorities?
Yes, thank you very much for the question. So the theme for this year TB Awareness Week is Yes, we can end TB, commit, invest and deliver. So which this theme serves as a powerful and a call to action and emphasize the urgent need for the government as well as the community and individual to solidify their commitment, as well as the increased investment to TB prevention and care to ensure that the effective delivery of services to the community and to end the global tuberculosis epidemic. The campaign highlights the need for high-level leadership, as well as increased investment and faster adoption to the World Health Organization's news for the TB guidelines to drive the efforts forward. We believe that this theme emphasizes the importance of sustained commitment, financial investment, as well as the effective delivery of intervention critical to TB prevention, diagnosis, and treatment, so that building on its massive uptake and the success over the last 2 years, this year's theme reinforced a powerful and a collective message for hope, agency, and accountability to all the governments and as well as the political leadership. I thank you.
Thank you for that very comprehensive response. Now, I'd like to get to you, Ms. Husselman. You are the founder of TB Free Namibia, a civic organization that's aimed at really advocating for sustained efforts in ending tuberculosis in the country, or reducing its spread, rather. Could you perhaps let us in on what inspired you to start this organization?
Well, thank you. I think many people know my story. I am a TB survivor, and for many years I've seen and observed and also experienced stigma, rejection, and a lot of misconceptions, a lot of ignorance regarding tuberculosis as a very devastating disease. And so I just thought that someone needs to be the mouthpiece. Someone needs to stand up for our patients, for the community. Sometimes people suffer in silence because of stigma. I mean, the minute someone hears that I have TB, they really they want to shunt you, they want to push you away. And a lot of this happens because people do not have all the knowledge. They may have a few, but they may not have everything to know what exactly is this disease about and why we really don't need to, to reject people who have TB. So that inspired me to start the organization. And we are, I think I can say that we support the ministry. We are the hands or rather we are we connect the community and the TB program, because we are ears on the ground as an advocacy organization. And so, yeah, and I love every minute of it, because it really is my passion to make sure that everyone knows what TB is about and really just understand the disease.
That's quite inspiring. Now, getting back to the ministerial perspective, could you perhaps provide us more insight, Ms. Paulus, on, or a brief overview, rather, of the country's progress over the past year in terms of TB control?
Yes, Namibia has made a significant, actually, strides in the fight against TB for the past few years, with a notable achievement which includes introducing newer diagnostic tests, and then as well as the latest treatment according to the international standards set by the organization, for example, WHO, as well as the implementation of innovative strategies, including the improved case finding, detection, early detection, as well as the treatment coverage. However, challenges still, regardless of the progress made by the country, the challenges such as the high TB incident rates, as well as the co-infection for HIV, which is at 31%, it's a very high rate for the country, still remains a challenge for the country. And also, in continuous, the efforts are needed to address these challenges and sustain progress towards the TB elimination in the country. While Namibia has made the strides in improving the treatment and diagnosis, there is still a need of greater investment, innovative technologies, as well as the diagnostic tools to address these issues, especially when it comes to hard-to-reach areas, as well as lack of infrastructures. And so this seeks, or it urges, sustained political commitment, as well as the multi-sectoral collaboration and innovative solution which will actually help us as a country in achieving the goal of ending TB in the country. With that said, thank you very much. Yes.
Now, Ms. Husselman, Ms. Paulus touched a little bit on the challenges that still remain in terms of eliminating TB or even controlling its spread. Could you perhaps let us in on what some of the challenges are from a civic perspective when it comes to TB control in the country?
I think I want to reiterate the issue of ignorance. There's a lot of people in our communities that don't know the basics of how we can prevent tuberculosis in the first place. But also, you know, just the mere fact that people think that TB is not an issue anymore. While TB is actually the #1 killer infectious disease, right? So in the world, not just in Namibia, but in the world. So it is the #1 disease that kills people. Millions of people die every year because of TB. And the issue is, it is so unnecessary because it's a disease that we can prevent, it's a disease that we can treat and cure. So I believe that we should not stop with our advocacy efforts, with our awareness raising, and that's why this awareness week for TB nationally is at the right time, you know, to just remind us again that we should not just focus on World TB Day, which is 24th of March each year, but it should be a continuous effort because, like I said, a lot of people suffer in silence. And I believe that also, you know, issues such as the fact that many people believe it's only, TB can only, you can get TB only in the lungs. Well, you can get it anywhere in the body, anywhere except the nails and the hair. So you can get it anywhere. So many people may experience TB, which is outside of the lungs, and not knowing that. And I want to add to that I think many clinicians, especially in the private sector, may think TB very late when it comes to extrapulmonary TB, which is TB outside of the lungs. So I think as a collective, Namibia really just need to, you know, everyone, corporate, government, community level, we should all remind ourselves that TB is indeed still a very high risk. It's a high risk. It's a threat still to public health in Namibia, and we are rated as one of the high burden countries in the world. There are 30 high burden countries, and Namibia counts or ranks 11th, which means we are still not out of the woods. We came down from, I think, 3rd, 4th, down to 11 out of the top 10, but we are still, in terms of TB, as a disease, but also TB, HIV, asthma, Paulus alluded to earlier. So these, I think these are the issues that the general person on the street don't know it always, but also high-level people sitting in their offices.
Yes.
You know, and I think the biggest threat is that people think it's not going to happen to me. While just the mere fact that we breathe means that we can get TB, because the minute I have TB in my lungs and I cough without protecting my cough and also not being on treatment for TB, that means I can just, send a big amount of TB bacilli into the air, and the person next to me can inhale it. And I think that is the other issue also. There's a difference between TB disease and TB infection. I don't know how much time we have, but I would like to also touch a little bit on that.
Please do.
Because, you know, TB infection is basically when you inhale the germ.
Yes.
It sits in your body, and if your body is strong, if your immune system is good, it can, the immune system can even contain it or eliminate it. And in other cases where the immune system is not so strong, people can get TB very easy. So that means that the germ or the bacilli that sits in the body can then multiply and become more and more and more, and then overpower the person's immune system, and then it can then progress to TB disease. So these are the two ends in the spectrum. So either you are exposed and you have inhaled the germ, it sits in your body, and for some people they can live for years without getting TB disease. And especially in children below the age of 1 year, 2 years, 1 year. If they inhale the germ, they can get TB within months, and they can get very severe TB, and they can die of it. So that aspect of, I think, probably 30% of Namibian, the Namibian population walk around with TB infection, having the germs in their body, sitting there sleeping, waiting for an opportunity for that immune system to become very weak, and then for the multiplication of the bacilli to happen. And if I can touch a little bit also on what are the risk factors for this sleeping TB to develop into or progress into active disease, is, in my opinion, right, HIV, of course, is the number one,
yes,
but also undernutrition. That is a big thing, you know, people's nutritional status, because if you don't eat properly, your immune system suffers from that, obviously. I think that is not rocket science to get to that. Yeah, and then also people with diabetes, they're also at increased risk, and then also children below the age of 5 years, they're also at higher risk of developing TB. I think let me stop here for now, because I don't want to to be a dialogue.
Yeah, that's quite informative, and you raised some very educational points in terms of tuberculosis, especially on the point of extrapulmonary tuberculosis, which, you know, I'm also learning now, which is why these conversations are so important.
Yeah.
But getting back to the Awareness Week, could you perhaps let us in on what some of the activities are planned for this year's TB Awareness Week?
Yeah, on the TB Awareness Week commemoration, we do have engagement with the regions, especially with the regional councillors, the regional health directors, Ministry of Education. Let me just say simply all the stakeholder line ministries just for the engagement. The regions to take up the responsibilities to make sure that they do educate, provide health education, sensitization to the community, just to engage with the stakeholders as well as the community leaders on the education for the community, for the people to partake in this whole and be aware of the disease. Like Ms. Karen has highlighted that it's a #1 top killer in the world disease, not just anything, and it's taken lightly by everybody. And we have this myth of like, I cannot get it because I'm white, because I'm rich, but unfortunately TB does not discriminate. And so with that, some of the activities the region are doing, the school health educations, we call it school health sessions, and as well as going in the community, have some community sessions through RACO community meetings and other engagement. They do some marchings or sports badge and whatnot. We do have some promotional items which we give to the community, to the regions, and then they use them as a kind of promotional materials. They engage with the community, they ask questions, you win a t-shirt or you get a speaker or a bottle and all sort of things. As for the head office itself, we are doing engagement also with the staff members, because we, as much as we are healthcare providers, at some point we also are not well capacitated with the TB information. How does it affect you? What are the risk factors? What are the symptoms? All of those things. So with that, we have planned some kind of sport things, matching, promotional items. You answer and question and answer, you win something, and also just to engage the stakeholders like schools, the mines, as well as the community councillors and others. So that's what we have in store for now. And also with that, we do have also community screenings that we do. We go in the community, we screen for TB, which helps people that are unable to reach the health facilities, that are not aware that there's TB in the world. Somewhere they are not aware that there's a disease called tuberculosis. We do go in the hard-to-reach areas of vulnerable population as well as marginalized community, targeting the mines. We recently also conducted active case finding in the correctional facilities, the prisons. So we did that also. So it's one of the activities that we've been doing just in commemoration of World TB Awareness Week up ahead.
Sounds like the ministry is quite active, and those program is very, very filled, which is very good because, I mean, like Ms. Husselman said earlier, there's a need to inform and educate on this matter. But earlier on, you alluded a little bit to some progress being made in terms of technologies to detect TB earlier, such as the 2-minute diagnostic process. But could you expand a little bit more on any initiatives, new initiatives, technologies or partnerships that are being implemented to really improve TB detection and treatment in the country?
Yes, we have been, usually we used to do the test using, it's called direct microscopy, which was taking a bit longer. And we now have a new molecular test, which is, it's called GeneXpect MTB RIF. It takes a maximum 2 to 3 hours. It depends on the workload also for the lab. Also, we have actually adopted the XDR. It tests for the drug resistance, because you do have TB that is, we call it a normal TB. It responds to the first-line drugs, and you have the TB that is resistant. What is the word resistant in Afrikaans? So you have, yes, you have that one that is, it takes a bit longer to treat, like 18 to 24 months to treat. But we have adopted the test, the new initiatives, like you can test somebody to see whether they are resistant instead of us blindly treating the person. And on the other hand, also we have adopted, or we have started using the chest x-ray with artificial intelligence, which is very quite effective, and it's helping us a lot. Compared to the normal chest x-ray you do in the hospitals, you just know that there's abnormality on the lungs. But with this AI cut for TB x-ray that we are currently using, it tells you exactly where is the problem, and if it's suggestive of TB, it tells you, it has a score, and then if the score is above 50, it's abnormal, and then if it's suggestive of TB, it's able to tell you, or a medical officer to say this is suggestive of TB, and then they do further. In that, we also do it in line or supported with the sputum collection. So if anybody has abnormal card for TB, we are saying artificial intelligence score, then we also collect sputum to just support our diagnosis. But the good thing is that it's not just any x-ray that we are doing, it's directing and it's guiding the medical officer, the medical practitioner, that the problem is exactly maybe on the lower lobe, it's on the left, and it's suggestive of TB. Not just TB, it's any other abnormality is able to tell, and then the medical officers can take it up there. But I would say the ministry have really done good in adopting and improving in the diagnostic new initiative that we have done. Yeah.
Wow, that is incredible work. Well, it seems like there lies a lot of work ahead in terms of spreading awareness from both the ministerial perspective as well as from civic society. But thank you, ladies, for your time this morning, and I wish you the best of luck with this TB Awareness Week.
Thank you very much.
Thank you so much.